Congressman Bilbray to get his take on health care reform. Lene, good morning.
Morning, you guys. He's facing a very tough crowd inside this breakfast this morning, but he's answered some very important questions. He took some time out to talk to us as well. We appreciate you doing that because I know there are a lot of folks in there who have some important questions for you. But give us some perspective on what's happening in there. What is it that people want to know about?
Well, they want to basically know what's going on. I mean, the fact is you've got a moving target. You got 4 or 5 bills. They want to see us do something. They want to know why they can't read it. A lot of people want to know why it's being delayed, and a lot of people are asking how are you going to pay for it. And so, this isn't any different than when I was a mayor or a county chairman. It's a great give and take kind of process, and maybe there ought to be more people in Congress that actually have come from a small city where, it's a tradition to talk directly with constituents, and it's sort of a great process rather than a lot of the stuff we see back in D.C.
We're talking about 5 bills that are out there. A lot of information, information that needs to be read and discussed. Give us your position on what you've read so far, and how are you feeling about it?
Well, one of the things we're concerned about is the fact that if this is such a crisis for the economy today, why is the implementation date being pushed off past the next presidential campaign, which is 2013? If it is a crisis, then we ought to be talking about doing something that we can implement quickly. And even if it means portions of this bill can be implemented, why put it off? I think that's reason. Why not take the time to allow people to read the bill? Somebody just said, what could we do to get this thing to actually be addressed? I said, demand that we at least have 48 hours to read a bill before we're asked to vote on it. I think that's one of the minimum standards that anybody would say is just common decency.
Now, you're facing some tough questions in there, too. We heard one gentleman ask you about the Republican Party and why it seems that they are opposed to any sort of public assistance when it comes to health care and supporting the private industry instead. Give us some perspective on that.
Well, I think that too many people think it's a choice between big government and big business. My concern, because I was the chairman here and provided health care, I see that the nonprofits are an option that the federal government is not tapping into. You should be able to give the consumer more than 5 choices they have now, or 6 choices with a public option. And by allowing, making it legal and encouraging nonprofits to get into it, like credit unions provide an essential service in financial services, we should use that credit union model and move that way. So I don't think it's an either or. I think people are trying to give us choices that is not going to work out in the long run. You shouldn't have to choose between big business and big government. You should be able to make it legal for people to get together, pool their risks, and cooperate in a nonprofit. Lord knows the credit unions have done a great job in this country.
And the reality is there are a lot of folks out there who don't have health care, who are in need of medical assistance and have nowhere to go. And so you're not saying that you're completely opposed to the idea of the government assisting in some way.
Yeah, and you got to remember that when we talk about the government, we always assume it's the federal government. Governor Romney has initiated a program in Massachusetts. They have a crisis there. They don't know how they're going to pay for it, but they're addressing it. I just think we got to remember that sometimes we always look to Washington to solve all the problems, but not talking about the debt that we're running up. We're in trillions of dollars right now, so how we pay for this is even as important as anything, because you can't promise a service that you can't pay for. I think we've seen what Sacramento's running into right now. You've got to figure out how you're going to finance every commitment you make. And right now, we're still facing major crisis, not just with Medicare and Social Security, but with who's going to be your doctor 10 years from now. Are we going to have physicians to provide these services? And I think one misnomer that we got to address is just because you get insurance doesn't mean you get access to a doctor. That's a whole new crisis that we ought to be talking about now rather than waiting for a few years and addressing it in a new crisis.
And you mentioned Medicare. There are a lot of folks out there who might argue, that they don't understand the opposition to the government being involved in health care because there are other social programs that we have in our country, Medicare, Medicaid, even the post office system. Those are programs that are already implemented in our country.
And to be, look, I'm ranking member on procurement and government oversight. When they talk about the postal system, Medicare and Medicaid, they're all in crisis right now. That is one thing that most people don't understand. We do not know how we're going to finance all 3 of those programs. Now, we have a constitutional responsibility to keep the Postal Service running, and we're going to do what we can to do that. But we need to address those issues before we start adding on to debt. And that's a legitimate issue, that any family that has a problem paying its debts does not take on new commitments until we straighten those out. And so I think that really responsible governance here says that We can work on this. What can we do that's not going to cost us a lot of money? How can we expand service? And how can we do this in a responsible way that the American people will trust? And I think one of the problems we have right now is a lot of things have been done the last 3 months so fast without anybody being able to know about it. And you end up with things like huge pay raises for AIG that members of Congress say they didn't even know about, but they voted for. And I wasn't one of them, but I think a lot of people are regretting that kind of force people to do things that they don't want to do until they read it.
Congressman Bilbray, we know that there are a crowd of people and they're waiting to hear from you again, so we'll let you get back to that. But thank you so much for your time.
Thank
we
you
appreciate it very much. All right, Dan and Sandra, there we heard from Congressman Bilbray speaking to a crowd of folks here in Del Mar. Obviously, a lot of questions about the health care issue. As we've seen across the country, people discussing it, a very emotional issue. But he's taking time this morning to personally answer some of those questions. And he was kind enough to take a few minutes to talk to us as well. Back to you guys in the studio.
It's like a full-time job for these guys these days.
It's interesting.
Boy,
No rest for the weary.
Yeah.
let me tell you, and that crowd in there is not being easy on him. They're asking what they want to know. They want answers, and they're not afraid to stand up and say, "Hey, we want to know what's going on." So it's very interesting.
Republicans seeing legitimate criticism, and then Democratic senators are seeing mobs. So it really just depends on your perspective there. It's good that discussion is being held.
That's true. Thanks,
That's
Lene.
what it's all about.
Thanks,
all right,
Lene.
take care, you guys.
Okay, we'll see you.